All right, it is 6 o'clock, and in the interest of time, we're going to get started. Welcome, everyone, and thank you for being here. We're going to start off with a quick note for our Spanish-speaking attendees.
Hola, buenas tardes. If you can go to the next slide, si puedes dar al próximo positivo.
Previous slide.
Or the previous, sorry.
There we go.
Para los que prefieren escuchar esta plática en español, por favor siguen estas instrucciones. Si están viendo esta plática por computadora, primero tienen que hacer clic en el globo en la parte de abajo de su pantalla. Luego tienen que seleccionar Spanish para escuchar en español. Luego van a escuchar la plática en dos idiomas, un poco más bajo el inglés y luego el español más alto. Si prefieren escuchar totalmente en español, por favor hagan clic en el mismo lugar, Mute Original Audio, para escuchar totalmente en español. Si están escuchando esta plática por teléfono celular, van a hacer clic en los tres puntitos en la parte de abajo de su pantalla, donde se dice More. Luego van a seleccionen Language Interpretation y luego seleccionen Spanish para el español. Y luego la misma cosa, van a escuchar dos idiomas. Si prefieren escuchar totalmente en español, seleccionen o silencien el audio original y marquen Mute Original Audio. Thank you. Gracias.
Wonderful, thank you, Ben. My name is Kim Kandeli'i, and I'm the Community Outreach Nurse at Valley Medical Center. We are here to answer your questions about COVID-19, address concerns some families may be feeling about having their younger children vaccinated, and bring clarity to a few of our countywide mandates. We have wonderful experts with us here tonight, and I will ask them to introduce themselves very shortly. But first, a few things to note. To start, this presentation is being recorded. So if you miss anything, or you want to go back and listen, or you want to share what you learned with your family and friends, the video will be posted on our YouTube page and shared across the social media pages of each of the organizations hosting this event in a few days. Next, I would like to say an enormous thank you to King County Public Health, Multi-Service Center, and the Renton, Kent, and Southside Chambers of Commerce for bringing us all together today in support of our community and to help us do what we can to fight misinformation. With that in mind, thank you to everyone who sent in questions ahead of time. We've collected all of our community questions and separated them into some common themes for our panelists to address. So we'll do our best to make sure each of these questions are answered. But if there is something we missed, we encourage you to talk to your child's pediatrician who knows their health history, and they can more specifically address your questions or concerns. Also, if you have a question at any time during this town hall, please don't hesitate to type it into the Q&A or the chat box, and we'll get to as many as we can in the time we have. Our hope today is to provide useful and factual information to our community, while still recognizing that everyone has a right to make their own decisions. So we are just here to give you the tools you need to make the most informed healthcare decisions for you and your family. And with all of that out of the way, let's meet our experts. Alphabetically, Dr. Del Beccaro, I'll ask that you go first.
Hi, I'm Dr. Mark Del Beccaro. Dr. Mark is what I have people refer to me to because my last name is long and too formal. I am a pediatrician, pediatric emergency medicine doctor by clinical background. I did that for over 30 plus years. I switched and joined the Public Health Seattle King County Health Department when COVID started to help in that area, and I have been on the team developing the strategy and implementation of our high volume testing and vaccination sites in South King County, particularly aimed at the communities hardest hit by COVID.
Dr. Hort?
So my name is Mike Horry, and I am an infectious disease doctor at Valley Medical Center, head of the infectious disease section, and also work with our infection control team here at Valley. I just want to put a shout out to Dr. Del Beccaro for all the great work he's doing with regard to getting vaccinations out here in this wild and woolly South King County area. So thank you so much, Mark. I appreciate it.
Taylor, I know we're not going to get to many questions for you till a bit later in the session, but do you want to introduce yourself real quick?
Yeah, hi everyone. My name is Taylor Gaston, and I'm a program director on our policy and government affairs team. And I also work on our place-based strategy team, doing some education and outreach to some communities in Kent.
Wonderful. Once again, thank you everyone for being here. I'm going to hand things over to Dr. Horry, who's going to give us a brief overview of current state of COVID in King County.
Thank you. Next slide, please. I just want to echo what Kim was saying before, that, many people are really searching for information about COVID and ways of protecting themselves from it. And there is a lot of information out there about this disease and measures to prevent it, including vaccination. Some of the information out there, particularly about vaccinations, is pretty anxiety provoking, but sadly, it's not as accurate as we'd like it to be in many cases. So we are really, really glad that you tuned in to us today to help you with your research and hope that you can use some of this information we give you to make decisions about protecting yourself and those you care for and love. In the end, as Kim said, you are the only people who can make the decision about what to do for yourselves. And we hope we're helpful to you. Next slide. So let's talk a little about COVID in the world and then drill down to King County. So this is the map at the Johns Hopkins COVID dashboard. And what it tells you is roughly the number of cases of COVID we've had in the world, the number of people who have died, and the number of vaccinations we have given in green. We have had roughly 253,800 COVID cases in the world, but this is probably a gross underestimate because these are only the cases that have been proven positive by testing. So there are probably many more beyond that. Further, there's been about 5.1 million deaths to this disease, which is just a tragic number. But a better number is in the green, and that is that we've had almost 7.5 billion doses of vaccine given out there. And that's something which might help us to get out of this problem that we are in currently. Next slide. Next slide, please. Sadly, I can't say that we're there yet. So this is a map of Europe, and what it depicts is a current surge which is going on there now. The dark red, orange, and brown areas are areas where the COVID disease is spreading rapidly. A lot of these countries are in Eastern Bloc areas where COVID vaccination rates are very low, but some of them are actually in Western Bloc areas where people have reduced some of their ability to protect themselves by getting into large gatherings, sort of forsaking their masks. One thing that's different about these two areas is that in the Eastern Bloc countries, there's a lot of hospitalization and deaths, but in the Western Bloc where there's vaccinations, the death rates are markedly lower than they have been in previous outbreaks and surges for this disease. Next slide, please. Next slide. Let's talk about the US. So far in the US, there have been roughly 47,145,000 cases of COVID. And sadly, again, we've had a tremendous death toll. It's 761,426 deaths as of Monday when I last checked. To give you a sense about how many deaths that really is, Dr. Duchin, who is our public safety officer for King County, put out a tweet the other day that pointed out that 350,000 people had died of influenza in the last 11 seasons. So we've lost almost more than twice as many in the last 2 years to COVID. So it certainly is not just a bad case of the flu. The the orange here points out that there's still a lot of COVID transmission here in the US. All the orange areas have greater than 100 cases per 100,000, which is a lot. Next slide, please. So let's look at Washington. In Washington, we've had approximately 750,000 probable and confirmed cases of COVID, 41,000 hospitalizations, and about 9,000 deaths, sadly enough. Next slide. To give you a sense of how important that is to us, COVID was actually the second leading cause of death in Washington State in September, and most likely in August, November, and October as well, although I don't have that data for you. So this has been a tremendous drain on our population at this time. It had only surpassed by heart disease, and it was more than deaths of cancer in the state of Washington. So a lot of death associated with COVID. Next slide, please. So let's look at King County. I have two graphs on here. One of them is a cyan colored graph, which is the number of cases, and then a more salmon colored graph, which is hospitalizations. Please take a look at the scales of these graphs. There's many times more cases than there are hospitalizations, but the trends are very similar for the two cases and the hospitalizations. You could see we got kind of a break in July, and then a very stiff upswing in cases and hospitalizations when this variant of the COVID disease called Delta hit our community. It stayed up that way for all of August and then began to slowly drift down in September, and is still coming down as far as cases are concerned. Sadly, however, for our healthcare institutions, at least in South King County, the numbers got kind of stuck in October, and we've had roughly the same number of COVID cases in our hospital now for the last month and a half, somewhere between 20 and 25. Not only are we having to deal with that extra population in our hospital, but we're also dealing with several COVID patients who are no longer infectious, but still remain in our hospital with various serious problems associated with their heart, their lungs, their kidneys, and other parts of their bodies. They also put a lot of pressure on our staff and our space here at Valley Medical Center. And there's also been a surge of other diseases, probably of people who've taken less well care of themselves, thanks to problems associated with getting healthcare in the COVID era. I don't want to get things wrong. If you come to Valley, we'll still take good care of you. It's just that whatever we can do to try and reduce these COVID cases, we here at Valley would really appreciate. Next slide, please. There's been a lot of discussion about children in COVID because of the vaccination availability. I'll just briefly touch on that. There's been about 2 million cases of childhood COVID in the US to date, resulting in about 8,300 hospitalizations when I last looked, and 150 deaths, which is tragic. Next slide. Okay, so what do we have coming toward us now as far as COVID is concerned? On my last talk that I did with Dr. Mint over in Covington, he pointed out something which I didn't know, that when you have COVID, you may have as many as 1 trillion viruses in your body. And those viruses are all trying to replicate. And as they do so, they're what we call mutable. They change with time. And the new variants can then spread. And if they happen to be more transmissible, perhaps more dangerous and more resistant to our immune system, they can go worldwide like the Delta virus did. There's currently a variant in Great Britain called AY4.2, which now makes up about 10% of all their variants there. It hasn't overtaken its parent Delta, but it's trying. So I think what we see in the future is that we're going to have increasing numbers of newer variants, which may come as surges into our community of new disease. So how do we stop this? Well, we do so by reducing the number of viruses that are out there mutating. And the best way to do that is keep people from getting this disease and providing it a place to grow. Next slide. Which brings us to vaccinations. I just want to go through this fairly quickly. There are currently 5 different vaccinations available. There is a Pfizer adult, a Pfizer pediatric, a Moderna full dose, and a Moderna booster doses. These are all what we call messenger RNA or mRNA virus, mRNA vaccines. And there's also the Johnson & Johnson vaccine there, which is we call an adenovirus vectored vaccine. Next slide, please. Who can get vaccinated? Well, if you're 5 years and older now, you can be vaccinated with the original series of Pfizer vaccine. If you're 18 years and over, you can get the Moderna vaccinations. These vaccines are 2 vaccinations. With the Pfizer vaccine, it's separated by 3 weeks. By the Moderna, it's 4 weeks. If you happen to have an underlying immune compromise, you can also get a 3rd dose. So these are people who might have cancer on chemotherapy, or have had an organ transplant, or maybe on a powerful immune suppressant for things like arthritis, and who may not have responded as well to the original vaccination. So we give them a little nudge to be able to get them better. Both of these are available for these patients about 4 weeks afterwards, and they are the full dose. For patients now who are 65 and older, or if you're 50 to 65 and have certain underlying health conditions that put you at greater risk for having a problem with COVID, you should get a booster shot. With the Pfizer, it's the full dose. With Moderna, it's a half dose, and you would get it 6 months after your original vaccination series. For Johnson & Johnson, it's 2 months after the original shot. And for people 18 to 50 with certain underlying health problems, again, that would put them at risk for having worse disease, or who live and work in high-risk situations, you may get a booster shot, similar to people who are a little older. Next slide, please. How helpful is the vaccination? Well, this is information that's put out by the King County Health Department on a weekly basis to show you what sort of advantage you might have if you were vaccinated. For instance, if you were not fully vaccinated, you're about 3 times more likely to get COVID infection. If you're not fully vaccinated, you're about 12 times more likely to end up in the hospital with COVID. And if you were not fully vaccinated, you're about 13 times more likely than a fully vaccinated person to die. And we see this all the time in the hospital. Most of our really sick patients in our hospital now are unvaccinated. Next slide. What about the duration of these vaccinations? We hear a lot about them waning these days and the need for booster shots, and that maybe these vaccinations aren't worth getting if they just last for a few months. But the truth is that although they may wane a little bit in terms of preventing you from getting an infection, their ability to protect you from getting really sick from the infection does not wane over time. These are 3 different surveys sponsored by the CDC, which show that the effectiveness of these vaccinations over a 6-month period since they've been available is still 90% plus against keeping you out of the hospital and keeping you from dying. Next slide. And for children, it's about 91% effective in preventing COVID disease based on our recent study. Next slide. What about safety? Well, in the US, we've given 437,352,000 shots of these vaccinations, which means that we have a lot of people that we can look to see how safe they are. Next slide. And the COVID vaccines are the most studied vaccines in US history with regard to safety. I myself counted at least 8 different systems that are watching out for side effects of these medications sponsored by groups like the CDC, the FDA, health insurance provider networks, research centers, and universities, all looking for evidence that these are not safe vaccines. Next slide, please. In total, what we found is the maximum likelihood of a serious permanent adverse event with a COVID vaccine in the adult population is currently about 1/10,000%. And that's looking at an awful lot of people, and it may actually be less than so. These are very safe vaccines. Next slide. Where can you get them? Well, I can't really address the issue of where kids can get them, and I don't want to steal too much of Dr. Del Beccaro's fire because he knows a lot more about this than I do. But I just want to say that most pharmacies can give adult vaccines of all different sorts, like I talked about. Also, there are a lot of clinics that are giving them out. CMAR, Kaiser, including non-members, Kent Public Health, Health Point Valley Medical Center has a clinic that works Thursday through Saturday, and we have all the adult vaccines available. I want to put a shout out to the Auburn Outlet Mall and their clinic they have down there. That's where I took my son, who's autistic, for his booster dose, and it was kind of maybe too easy to get. We just wandered in and got it. They didn't even ask any questions, so it was great. There are also some pop-up clinics that have showed up on specific dates, like I have listed here, including at the Auburn Teen Rec, Multi-Service Center in Federal Way, Sullivan Center in Tukwila, and the South Park Senior Center. So with that, I'll just go ahead and conclude right at the moment, and we'll go onward to the questions. And I'll turn the mic back over to Kim. Thank you.
Excellent. Thank you so much, Dr. Corey, for that overview. I'm going to swap to Dr. Mike and Dr. Mark. So Dr. Mark, got a quick question for you. One of the most common questions we received relates to why children should be vaccinated, particularly when cases are often considered to be mild in children. Why aren't our precautions like mask wearing and hand washing enough?
Great question. And, and thanks for Dr. Mike for leading off and giving some of the background information. I think as we talk about these issues, one of the things I want to reinforce is to make sure that you have conversations with some healthcare provider you trust, your pediatrician, family practice doctor, or someone else, to help reinforce and get better answers if you're still having questions about whether or not to proceed. But around the specific question of why would I vaccinate if the case might be mild? Well, first of all, there is that if the case may be mild, even though it is a lower probability, it's not a zero probability. And in some states, luckily not here in King County, the children's hospitals ICUs, just like the adult ones, filled up with kids with COVID. And certainly if kids have underlying diseases like cancer or other things, getting COVID could be a very serious and unfortunately could lead to long-term problems or mortality. So for one is it's not zero. I think the other and probably more palpable or real thing to people is our kids are not leading normal lives, and it's affecting their development. It's affecting their ability to stay in school. It's affecting their ability to just be a kid. I have 6 grandkids, and many of them are in school or in daycare. And every time there's an exposure, kids get sent home, they have to get tested, they can't go back to school, their parents have to take off work or their caregivers have to take off work. And, the disruption and the anxiety over that is a lot for a family and it's a lot for a child. The other thing is that there's the fear of getting together. Kids don't go see other kids because they're afraid. And the only way we're going to get out of it is by getting people vaccinated enough that just like the flu or chickenpox or other things, none of which are as deadly as COVID, are under control and not going to happen all the time. We're heading into and already started the winter respiratory viral season. I was an ER physician for over 30 years, and every fall and winter, the ER would fill up with kids with things like RSV or other viruses. Well, now every time somebody gets a cold, they don't know if they just have a virus or whether they have COVID. And that causes more anxiety and fear in families and in children. And I've seen it in my own grandkids. So the one of the reasons we need to do this is we need to allow our children to have a normal life again. And the only way to do that is to get enough children vaccinated that we don't have to fear that every single infection could turn into a COVID infection and allows them to go to school without being sent home every week or every other week because of a potential exposure. And finally, the last one is kids are not good at keeping their germs to themselves. I always used to make a joke to parents that you could tell how tall a toddler was by looking at the back of your legs and seeing where they rubbed their face into your legs when they held on to you. Well, those toddlers and those kids hang out with their grandparents and with other people who don't necessarily fight infections as well as a healthy 5-year-old would. And so part of what we want to do is also make it safe as we go into regular holidays and other things, that child won't give COVID to somebody who won't have a mild infection. And no family wants to have to worry about, will my 5-year-old or 7-year-old pick up a COVID infection at school, maybe not be that sick, but give it to grandma or grandpa or somebody with cancer or something and have them get really sick or potentially die. And so we want kids to get vaccinated so they can be kids, so that they can be families, and so that they and their family don't have to worry all the time.
I just want to go ahead and piggyback onto that just a little bit. The CDC actually has quantitated this, and they put out a study here in October that showed that 140,000 children have lost a parent or a secondary caregiver to COVID. So there are people that are literally become orphans based on this disease. And so, way to make them, help them protect themselves and their families is by vaccination.
And we also know there's a lot of studies in the pediatric literature that children who are frequently missing school or having these other things are suffering significantly in their academics, and that will handicap them going forward. And we want kids to be able to reach their full potential, and they don't need to have the extra burden of COVID absences at school and other things adding into that.
So Dr. Mark, follow-up question for you, because I think this is another question that we've heard a lot, and that relates to safety. So how can parents feel sure that there's enough evidence to know the vaccine is safe for their children, especially for those that are concerned about things like long-term side effects, possible fertility issues, or those that would kind of rather wait to see how it goes with other kids getting vaccinated before they vaccinate their own?
Right. And again, those are great questions and completely understandable. And, everybody has to make that decision about their children. And again, I would ask you to spend time with your pediatrician or family practice doctor or other provider. First of all, there is no medication that's safe. I worked in an emergency department and had to give medications that to treat diseases that sometimes were mild medications and sometimes were really powerful ones. And they all have the risk of side effects. There is no medicine that's 100% safe. It just doesn't exist. Even common antibiotics that kids get put on can lead to very serious side effects sometimes. They're incredibly rare, so we accept the risk of that. So first of all, I want to acknowledge there is nothing that is completely 100% safe. The second is, as Mike showed Dr. Mike showed, there are literally millions of people that have been given these vaccines, much more than anything else that's ever been studied, and more than some of the things that people hear about on the internet to treat COVID that have been given to far less people and have far more side effects. One of the things I always tell people is RERs and hospitals and ICUs are not filled with people with side effects from COVID vaccine. They're filled with people that have COVID. One of the ones that affected young males in particular was myocarditis. I actually reviewed many of the charts of that, and we had a review with the CDC on the cases that happened in King County. And both in King County and nationally, while there was a small percentage of young males who got it, almost all of them got over it in a very short period of time. There were no serious long-term side effects from that. And again, it's less than the number of kids who were hospitalized. So even though some kids did get myocarditis, they all recovered, usually in less than a week, and they all did well. We already have 30,000 kids in King County, 5 to 11, who have been vaccinated. And if you get myocarditis, you get it in the first week, usually in the first few days. None of them have had it, and none of the kids that were in the study to get the vaccine approved got myocarditis in the 5 to 11. So it doesn't mean it won't happen, it just means it's rare, and that it will probably go away with very conservative treatment. I do want to talk about the fertility one, because that's a very common, unfortunate myth that has been frequently talked about. That started back in the beginning of COVID by a scientist who thought that the vaccine might share some common proteins with the female reproductive organs, like the uterus. Other scientists quickly showed that that was not true. And we have had, I forget how many Dr. Mike showed, but billions of doses of vaccine given out women are still getting pregnant and still having babies. We actually do have data that shows that women who are not vaccinated, unfortunately, have a higher pregnancy death rate and a higher loss of babies if they're not vaccinated. That same doctor who gained a lot of fame for doing that way back at the start of COVID also said that COVID would kind of go away and wouldn't be that big a deal, and not that many people would die of it. So that person unfortunately got famous for what he said in the sense of it got picked up by the internet, but when things get picked up and repeated does not make them true. We know that women are having babies who have been vaccinated without difficulty.
Women are also far more likely to get sick with severe COVID if they are pregnant. About 2 to 3 times more likely to have severe disease if they're pregnant than if they're not, because it kind of suppresses your immune system a little bit just to be pregnant so you can carry your baby. Currently, about 173,988 women who are pregnant are being followed closely by at least 3 different systems looking at safety. And there has been no signal of any sort of safety events associated with vaccination and pregnancy. So actually, truth be known, we strongly encourage pregnant women to get vaccinated because it's a good way of not only protecting you, it protects your baby, and you can provide your baby with antibodies that will protect them from COVID even after they've been delivered. So it's a win-win-win situation as far as vaccination and pregnancy is concerned. It's something that we would strongly recommend.
Great, thank you.
I would go back to the message though. Please talk to your providers. There's literally millions of people that have had this vaccine, and you have the much higher risk of getting the disease and getting sick than any side effect.
I'm going to take a quick moment to pause for our interpreters before I move on. And Dr. Corey, this next question is for you, Dr. Mike and Dr. Mark.
Yep. That's right. We're sharing the podium with a pediatrician.
M&M.
Perfect. So we're going to talk about the difference in the vaccines now. The Pfizer vaccine, we know that the dose for children is smaller than that adult dose. Mm-hmm. So is that the only way the vaccine differs? Does it mean it'll be less effective, or that parents might see different side effects than they would normally see in an adult?
Not at all. Well, the vaccine is about a third the dose of the adult vaccine. That actually also is the case with influenza vaccine for very young children. So it's not something which we haven't done before in the past. Kids are smaller. I mean, they are in that age. So they need a little less medication for their size. Pediatricians, I really admire them because they're very good at calculating. We in adults have very standard treatments for our patients, but for those pediatricians, they have to sit down and look at the size and figure out what their dosing is too. So I have real respect for Dr. Del-Beccaro, particularly in the heat of an emergency room. But it's more than just that. I mean, kids are being exposed very rapidly when they grow up to a world full of infection, little microbes everywhere. And they have to build immunity quickly to just a huge number of different things, or they're not going to make it. Dr. Del-Beccaro already told us about how hygienic they are with regard to, slobbering on their pants and stuff like that. So if they don't build up immunity fairly quickly, I mean, they're done. So, kids are literally made to be able to develop immunity fairly rapidly to fairly small amounts of immunogens so that they can go ahead and protect themselves. So it's more than just, their size, which also speaks to the fact that, as they get older, you still do pretty well with those lower doses. As far as side effects are concerned, pretty much the same as adults and perhaps a little bit milder. Nothing long-term, nothing serious, pretty much like Dr. Mark was talking about earlier. So, they're not going to be any worse for getting that smaller dose. They'll eat it up and they'll build up antibodies. That's what all the studies showed. They built fairly good protective antibodies with that level of dosing. So they did a good thing with that.
Dr. Mark, as our pediatric specialist, we got a couple of kind of specialty questions that came in that I'm going to pivot to you for.
Sure.
I think they'll be pretty quick, but the first one talks about if my child is 11, should I wait to get them vaccinated until they're 12 so they can receive that adult dose, or will they still be equally as protected at that lower dose?
No, they'll be protected. And it is true though, because this does happen. If you start 11 and by the time your booster comes around, you're 12, you will get the bigger dose. But as Dr. Mike was pointing out, kids are really good at amping up their immune response. And this was studied and will continue to be studied. I am fully confident that the kids will get the right amount. And in the studies where the original children were in the study, they drew blood levels and watched them for many months and watched the antibody levels, and that dose worked just fine.
So the second one related to third doses. So we talked about immunocompromised adults receive a third dose to be considered fully immunized. So is there a recommendation the same for children?
So I'm going to answer that in two parts. Not yet, but it may well be down the road. The not yet part is because the kids who are immune compromised haven't been studied far enough out to see whether or not their antibody levels are going to drop. Would it be theoretically true in the future? I think that is probably a good probability. Right now, we just don't know. I would point out though, if parents think about it, a lot of the immunizations kids get have booster doses down the road, and even adults do. So all adults get tetanus booster doses. And we even found out that we need other booster doses as adults. So for people that are as old as Dr. Mike or Dr. Mark or Dr. Mike, we might get the varicella zoster booster dose. Well, it's basically the chickenpox virus. It's just a different variation of the same thing. But that's because as you move along, your antibody levels may drop. So while right now we don't know that they would need a third or a booster dose, it's quite possible that down the road they would.
So Dr. Fori, some of the questions we received express concern that the vaccine may be riskier for children than actually getting COVID. Can you speak a little bit to that concern and also talk about if there are children that maybe shouldn't get the vaccine? For instance, we had someone write in to say that their child had a disability and they weren't sure if they should still get them vaccinated.
Well, with regard to the safety of the vaccine with relative to COVID itself, I think Dr. Mark has really addressed that in some detail. Just want to add that, if you take the population who get this heart inflammation, which is one of the few vaccination-related side effects that we've really pinned down, in the group of individuals who tend to get it the most, which is males between about 12, 29 years of age, you're about somewhere between 6, depending upon the study that looks at it, somewhere between 6 and 34 times more likely to get a heart-related problems like myocarditis or pericarditis associated with COVID than you are with the vaccination. So that's just one very specific example about how COVID itself is more dangerous than the vaccination. But, Dr. Mark has really talked a lot about that. As far as the kids with disability is concerned, I mean, if you look at, for instance, this thing we call monoclonal antibody treatment, Regeneron, there's a couple other ones out there right now, which we give here at Valley Medical Center for people who have COVID to try and prevent them from ending up in the hospital. One of the reasons why we give this medication to them is neurodevelopmental delay problems. And so, people who have these problems, people who have disabilities, my child, for instance, are actually at somewhat greater risk of getting severe COVID disease, particularly if they have significant underlying heart or lung problems. So I think that the truth be known, kids who have, health-related issues above and beyond normal really probably deserve to be vaccinated more than your average child, because they may be at increased risk for getting severe disease. So I think as far as it goes, the reasons for not giving somebody a vaccination with the pediatric group, with the kids, are pretty much the same as adults. Severe allergic reactions to the vaccine or components within the vaccine are the major reasons why you wouldn't want to give somebody a vaccination at this point, even if they're 5 to 11. Otherwise, it probably is a good idea.
We're just a tiny bit ahead of schedule, which is exciting. So I'm going to ask
So
a couple
can
questions.
I
Oh,
add
yeah.
on to that?
Yeah, let me
So-
pause for interpreters real quick, just in case they
Sure.
want to switch over. Go for it.
So adding on to what Dr. Mike said, there is actually some data that shows that kids with disability who get COVID, who are not vaccinated, are at higher risk of dying. So it's actually the opposite. They should get
They
vaccinated.
should get vaccinated. You really
The-
want to get those kids
The
vaccinated.
group that should wait is one group Dr. Mike talked about are people that were treated for a COVID infection with an antibody treatment. The
Right.
other group that right now should probably wait while we gather more data are children who got COVID and got what's called multi-inflammatory system disease that affected their heart. So these are kids who got this from COVID. And right now the feeling is they should wait a little bit after that. And they should talk to their doctor and maybe their pediatric cardiologist, because if you got what's the initials are MISC, if you got that heart problem from COVID, you're most likely being followed by a pediatric cardiologist, and they should probably not get vaccinated right away and until more data comes out. So again, it's the question, it really comes down to people who have COVID and have had a bad outcome. There may be a few instances where they shouldn't get the vaccine right away, but there's a lot of data that shows that unvaccinated kids with special needs are actually at higher risk, so they should get vaccinated.
Just to let you know too, at least I'm not so sure, I'll defer to Dr. Mark about this, but if you're an adult and you get COVID, that does not mean you should not get vaccinated. It turns out, at least in the adult population, you're about 5 times more likely to get COVID again just from the natural disease and not getting the vaccination than if you do get the vaccination. So as soon as you're safe to go out again, you're eligible for getting a vaccination. Even if you've had COVID, you should still go ahead and get it done. I mean,
that is true for peds. It's only this small subset that had this
Right.
heart inflammation.
So the natural disease doesn't protect you as well as we'd like to. I mean, there's this community down in Brazil, they looked at transfusion information, and very similar to the US, they found out about 76% of the population got whacked with COVID in the first round in the spring of 2020 and had antibodies to COVID. But when a new form of it went through their community called P1, everybody got it again. I mean, it just went through the community one more time. So that's the problem associated with these things, which we call variants, is that, you know, you may have immunity to one form of the virus, but not to a subsequent one. And that's actually very common for all coronaviruses, which have a tendency to go through the community again and again and again. So getting vaccinated is important, even if you've had the infection.
Well, I'll ask maybe 1 or 2 more, depending on how much time they take to answer, and this can be for either of you. Another one we got pretty recently was a child who had gotten COVID about a month ago, and they're just wondering what the best time is to vaccinate now that they're recovering.
Sure, I'd be happy to answer that. And it's actually pretty similar answer for adults. Our basic answer is once you're through the acute infection and you're no longer having acute symptoms, certainly not, somebody that would be still hospitalized with worsening symptoms, it's okay to get vaccinated. We usually say it's probably best to wait 10 to 14 days so that you're no longer infectious and you're through that phase. If you wait a little bit longer than that, that's okay. But certainly anytime after 2 weeks for most people, it's safe to get vaccinated. And interestingly, and Dr. Mike has probably seen this also, it turns out that people that got COVID and get vaccinated have the highest antibody levels of anybody.
You're supercharged. Yeah, bulletproof, at least for now. I have
So
a
I think I
question.
will ask one more just because I really like this question and I think it's an important one for people. And it's pretty general. It just asks, how can we identify reliable information versus rumor? Anyone got some good tips for the public?
Well,
Wh-
go ahead.
Go ahead. I always say, you know, these are really tough questions. And when it comes to your child, they're even tougher. That's why I go back to always, please go to your trusted physician or provider, whether whoever it is that you go to, and bring them the questions, even ones that you might be afraid to ask, because you have to have a conversation about those. You know, sure, it's easier. You can definitely trust information that's on like the public health website or the CDC, but some people don't trust those sites. I would caution anybody that is just, you know, following a Twitter feed. The people who put things on Twitter don't have to have them verified. So if you're getting your information from Twitter feeds, it's, you know, would you trust your bank account on a Twitter feed? And if you wouldn't trust your bank account, why would you trust your child?
Absolutely. I agree with Dr. Del Beccaro. Talk to somebody you trust.
Perfect. So I'm going to give our providers a bit of a break. We're going to pause here for interpreters as well. And we're going to bring in Taylor so that we can talk about some of our countywide mandates. Thank you for being here, Taylor. So I'm going to lump a couple of your questions in. There's like three that were kind of related to each other that I'm going to ask first. And a lot of them are about businesses and showing proof of vaccination. So how do businesses know whether they qualify as required to request proof of vaccine? Do they need to check an ID also, like the driver's license? And will children be included in needing to show proof of requirement?
Yeah, thanks, Kim. Those are all really great questions. So first I'll talk about the businesses and establishments that are covered under the order. So that would be restaurants and bars with 12 or less seating capacity. And so only indoor dining, so no takeout, no like grab and go settings. So a good example would be a Starbucks in a grocery store or a mall food court. Those would not be covered under the order. We're talking solely restaurants and bars, with indoor dining and 12 or more seating capacity. And then also there's indoor recreational events or establishments. So that could be professional sports, collegiate sports, performing arts, live music venues, going to the theater, gyms, conference halls, conventions, community centers, all covered under that indoor recreational event space. And then lastly, any outdoor event with 500 or more people will be required to show vaccination. And then also I did want to mention that restaurants with 12 or less seating capacity, they will have until December 6th to implement the order to give them a little bit more time to comply. And then addressing the question, should businesses or establishments be checking identification? The answer is absolutely not. If you are being asked to show identification, that is against our anti-discrimination policy. So no business should ask you for that when you're dining or frequenting their establishment. And this also could mean a negative test as well. So proof of vaccination or a negative test. And then children under the age of 12 will not be required to show proof of vaccination or a negative test. And this is through the life of the order. This will be not required for any child under the age of 12.
Excellent. So can you talk a little bit about the new OSHA mandate that's regarding the need to regularly test unvaccinated workers for COVID and what business owners should be aware of with those requirements?
Yeah, that's a really, really great question. So as of November 12th, actually, the U.S. Court of Appeals for the Fifth Circuit, they ordered that OSHA actually to take no steps in implementing or enforcing this. So as of right now, the establishments do not have to check for vaccination or regularly test, but the OSHA mandate, like I said, is currently on a hold. So the recommendation right now to businesses and establishments is for you to still follow the ETS, which is the Emergency Temporary Standard, while this is under litigation. So completely up to the business or the establishment, but it is recommended that you are either checking that your staff is vaccinated or testing them regularly, but right now it's not a requirement, and that's as of November 12th.
It is common sense, though. I mean, it's hard enough to get employees as it is right now without losing them to COVID. So it makes some sense to be able to protect your employees.
Absolutely, and that's one of the reasons why they're just saying that they recommend that you still are checking that while this is under litigation. And you do want to keep your staff, especially your unvaccinated staff, safe during these times.
Absolutely.
And will there be opportunities for financial support to help businesses that are affected by the mandate?
Yes, there are. So currently there are a few opportunities throughout all of King County. One specifically is the South King County Community Impact Fund. And this is a recovery program that allows businesses to apply for financial compensation ranging from $100,000 for the whole year or $250,000 for, I think it's up to 5 years. And so this is funding that's available to our restaurants and businesses that are in South King County. And then for the city of Seattle, they recently have announced a $2 million fund for our small businesses, and this allocates about $2,000 for businesses, and then certain specialty businesses and organizations will receive an additional $1,000, and this is specifically for only Seattle. And then for the rest of the county, there are a few more opportunities. There's the Digital Equity Grants Fund, and that actually closes on November 30th. So there's still some time for that one. And then there's also the Coalition Against Hate and Bias Grant Program, and that one closes on December 8th. And I do want to kind of highlight that one a little bit, just because if there are businesses that have had some discrimination issues, this specific grant would be perfect because it does address the equity issues that could be centered around mandates and things of that nature. And then lastly, there are the small business loans that are offered through the U.S. Small Business Administration, and those will vary in amount.
Okay, so that was a lot of the questions that we had planned for that. So I've got a couple that I can ask. I think I'll direct this one at Dr. Mark because it's pretty specific, and they're asking if the Pfizer vaccine has been linked to pediatric appendicitis as a side effect. That's something you've heard.
That there's nothing in the literature or in the group of children that were studied that showed that.
That's a fair bit of the extent of the questions we've gotten.
Well, so to further that, I think it's a good example of how to look at data because, and as a pediatric ER physician, I saw a lot of cases of appendicitis. Appendicitis happens at a pretty regular interval. So just by chance, it will happen at the same time as something else, like getting a vaccine or something. Now, there were vaccines for babies that did cause some abdominal things, but that was a very different vaccine and issue. But there's not been for this. It is true that, like I would see kids with broken arms who had gotten vaccinated the day before. That doesn't mean the vaccine caused them to get a broken arm. So kids will get appendicitis after getting the vaccine, but that's just because of sort of the randomness of how people get appendicitis.
Can I ask Dr. Mark a question that's in his wheelhouse? How do you get your kids vaccinated? What's the outlook for getting them? It sounds like there may be a little bit of a slowdown in the flow.
Yeah, the amount of vaccine coming into the state is not where we want it to be right now. It's a little bit, unfortunately, reminiscent of the beginning of when we were vaccinating adults. We did get a little bit more even this week than we thought we would get last week. I was amazed to find out that already 30,000 kids 5 to 11 have received the vaccine. So that's an amazing start. I'd have to look over my shoulder here to look. That's actually 17% of the kids in King County
Wow.
that are 5 to 11 have already gotten the vaccine. And like I said, that's, 31,000 kids have received that vaccine and not had any, they get sore arms and, maybe feel a little fever, but they're not in the hospital. They haven't had heart problems, nothing like that. And so it's going to be a little bit slow, but our guess is that that families that want their child vaccinated over the next few weeks will be able to get it. Maybe not exactly where and when they want to. I think one of our concerns as public health and you all who serve the South County is access points in the South are not necessarily as plentiful as they are in some of the more northern parts of the county. So please, use the vaccine finder. If you're having trouble or navigating, please find a friend or a family member that's good at using the internet to help, and check with your pharmacies, your schools. King County Public Health is working with a lot of school districts to do vaccine events. So there are places to do it. It'll just take a little bit of persistence over the next several weeks.
And now we've only got a couple minutes left, and I want to ask a quick question that we got in the chat, which is if Moderna and Pfizer are the same technology or similar technology, how come Moderna is not being approved for kids like Pfizer is?
Dr. Mike, you want to do it or you want me to? It's up to you.
Well, I mean, the study has been done and the information has been submitted, but the FDA and CDC are still evaluating at this time. So more to come.
Yeah, I think people should take that as an example of how we don't approve things, the FDA and the CDC, until they really look through the evidence thoroughly. Right. So the fact that it hasn't, happened as fast as Pfizer means that they want more data and they want to look at it more carefully, which is a good thing.
I don't know if any of us can answer this question. I'm going to ask it just in case we can, but somebody's wondering if clinics and pharmacies that administer vaccinations, if they get paid to do that.
Not basically, they get some money to cover the cost of administration. They don't make money on it. And most of them would argue that the money they get to cover the cost of administrating it doesn't come close to the actual cost. So most of them are losing money doing it.
That was the case for the hospital too. We actually looked at that. I admit it. We looked at that at the beginning of the epidemic, and we realized that the amount of money that we could charge for what they call a facility fee for doing this wasn't worth the effort, and we stopped. We didn't even start really. We just, gave the vaccine. It was 100% free.
Is there anything else either of you would like to add before we wrap up for the night?
I would just say, vaccinating your child or getting healthcare for your child is a very personal thing. It's normal to feel anxious about those things. I can tell you that in years of working in ERs, I've had a lot of very sad conversations with families who didn't vaccinate their kids against other illnesses and got sick. It's not a good conversation to have with anybody about their child. So if you have issues or you have concerns, please talk to somebody. These are safe. 4 of my 6 grandkids have gotten it. The other 2 are too young, but soon they'll get it too.
My granddaughter is just getting there. So she'll be vaccinated in January. I guess my point that I wanted to bring out was kind of what Dr. Mark talked about before when he was talking about the person who was dealing with infertility issues, in the sense that, you know, COVID is going to be going away. It's not that big a deal. No, I'm sorry. The data all suggests that the COVID is probably going to be around, that we are going to continue to see sort of this up and down in our communities. And so, you know, it behooves us to be able to protect ourselves, because I don't think it's just going to burn out. And I think the vaccinations are one of the ways that we turn COVID from being this god awful mortal disease to being something that's just like annoying, and, you know, protect ourselves and people who are at risk.
Wonderful. Well, thank you everyone for joining us. Thank you to Dr. Mike and Dr. Mark and Taylor and Ben for their insight and their expertise.
And thank you
To our
really
amazing
for,
interpreters that have been translating this video in Spanish in real time. Thank you to King County Public Health and Multi-Service Center, Renton, Kent, and Southside Chambers of Commerce. You're all amazing. I hope everyone has a great night.
Thank you, everyone.
yeah, and thank you so much for watching us. We really appreciate you taking the time.